Hello, I'm Chuck Bayard, the Indian Creek Hospital Property Manager. We are excited about the new Indian Creek Hospital and passionate about providing our staff, patients, and visitors with a safe environment. This video will cover the Indian Creek Hospital safety items and locations.
Fire exits and fire pool handles. In the event of an evacuation, fire exits are located at all Level 1 exit doors. Lower level, Level 2, and Level 3 will use stairwell doors as fire exits. These are located in two areas. One at the far southeast end of the building by the lobby behind the elevators. The other is at the far southwest end of the building to the left of the elevators. Please do not use the elevators to exit the building during a fire alarm activation. Fire alarm pool handles are located at all Level 1 exit doors, all stairwell doors, main lobby entry, all nurses' stations, and the receiving dock. Fire extinguishers and the different types. Fire extinguishers are located in the hallways close to the stairwell doors on each level. Class K fire extinguisher, used for grease and kitchen fires, are located on the lower level by the kitchen entry and exit door. Deionized water fire extinguishers, used in the ORs for the patient's safety, are located by the entry and exit doors to the central core. MRI-safe fire extinguishers are located outside the entry and exit doors to each MRI suite. Smoke and fire barrier walls. Starting with the lower level, if a fire occurs in the north side of the building, staff and visitors would move to the south side. If a fire occurs in the south side, they would move to the north side. On Level 1, if a fire occurs in the west side, staff, patients, and visitors would move to the east side. If a fire occurs in the east side, they would move to the west side. On Level 2, if a fire occurs in the north side of the building, staff, patients, and visitors would move to the south side. If a fire occurs in the south side, they would move to the north side. On Level 3, if a fire occurs on the west side, staff, patients, and visitors would move to the east side. If a fire occurs in the east side, they would move to the west side. Medical gas shutoff. During normal business hours, respiratory therapy or their designee is responsible for shutting off medical gas valves on Level 1 and Level 3, which includes inpatient unit, interventional radiology (IR), PAC, and radiology. They will consult with the IR charge nurse or unit coordinator prior to shutting off to the IR radiology area to ensure patient safety needs. The anesthesia department or their designee is responsible for shutting off medical gas valves on the Level 2, which includes the OR and pre and post. After hours and weekends, the inpatient unit coordinator or designee is responsible for shutting off medical gas valves as needed.
Are you paying attention?
Radiology zones. Zone 1, blue, is every area on Level 1 that leads up to the radiology hallway. The area is freely accessible to the general public without supervision. Zone 2, green, is the radiology hallway on Level 1. The area is still a general public area with minimal supervision. Zone 3, yellow, is the hallway by the MRI control room on Level 1. The area is locked down for limited staff and general public access. Staff must have completed the MRI safety training in order to access this area with MRI staff supervision. The general public must be accompanied by MRI staff. Zone 4, red, is the MRI suite on Level 1. The area is locked down to staff and general public. Only access is with MRI staff. No metal objects, unless they are MRI safe, can be in this area. Tornado safe areas. Tornado safe areas are all hallways, stairwells, and inner rooms. Try to stay away from any windows or glass. If a patient cannot be moved from the room, move them as far away from any window or glass and thoroughly cover them with blankets, pillows, or a mattress. The basement is the safest option if you can make it there safely and in a timely manner. Code carts. Adult code carts are located on Level 1 in the MRI corridor, interventional radiology, and in the clinic. Level 2 locations include pre-post and in the OR core. There are also 2 adult code carts on Level 3 in the inpatient unit. Pediatric code carts are located in radiology on Level 1, pre-post on Level 2, and on the inpatient unit on Level 3. There is 1 rapid response cart located on the inpatient unit. There are numerous emergency code carts available. Departments are responsible for checking these daily and completing the checklist when their departments are open. The daily checklist must indicate closed on days that the department is not open. If the department is called in after hours or on a weekend or holiday, the cart must be checked. Stat packs. There is 1 stat pack located at the east wall of the lobby at the security desk, equipped with basic supplies that would be needed to respond to an event outside of the building, such as the parking lot. Waste bins. Acceptable black bin items include hazardous pharmaceutical waste that have bulk greater than 3% of contents remaining and were not fully administered. Acceptable red bin items include blood and other potentially infectious material, soaked, dripping bloody dressings, tubing, bags, homedics, intact glass or plastic with body fluid.
Thank you for viewing this video. If you have any further questions, please contact Jenny Maddox or I. Thank you.